I remember the exact moment it started, not with pain, not with something obvious, just a faint, almost ignorable sensation. The kind most people brush off without a second thought. But what stayed with me wasn't the feeling itself. It was what came right after. That quiet wave of worry, the kind that doesn't scream, but whispers, "What if this turns into something expensive, something painful, something I can't avoid?" And the truth is, if you're watching this right now, chances are you felt that too. That subtle discomfort in your tooth, followed by a flood of thoughts. The cost of dental treatments, the uncertainty. Maybe you don't have insurance. Maybe the last time you went to the dentist wasn't exactly a great experience. So instead of acting, you wait. You hope it goes away. You tell yourself it's nothing, but deep down, you're not really convinced. What most people don't realize is that this reaction, this hesitation, isn't about neglect. It's emotional. It's learned. For years, we've been conditioned to believe that dental care only starts when something is already wrong. When there's pain, when there's damage, when it's already too late to do anything simple about it. So we associate the dentist with intervention, not prevention. And that's where everything begins to shift. Because what if I told you that in many cases tooth decay doesn't start as something permanent? What if the early stages, the ones most people ignore, are actually your body trying to recover? This is where things get interesting. Tooth decay begins with something called demineralization. It's when acids from bacteria start pulling minerals like calcium and phosphate out of your enamel. At this stage, there's no cavity yet, no drilling required, no irreversible damage, just a weakened surface, quietly asking for support. And here's the part almost no one talks about. Your body has the ability to reverse this process through something called remineralization, but only if you act in time. That window is where everything changes. Most people miss it. Not because they don't care, but because no one ever showed them what to look for. Those faint white spots on teeth, that slight sensitivity, that subtle roughness when you run your tongue across the surface. These are not random, they're signals. Signals that something is happening, but still fixable. And while many continue to delay action, fearing cost, fearing discomfort, they unknowingly allow a reversible stage to become permanent. That's why understanding this early phase isn't just helpful, it's critical. And if you're someone who's been putting this off because you're worried about expensive treatments or painful procedures, there's something important you should know. We've left a practical guide in the first link in the description for you to access quickly. Click and see. It walks you through simple, at-home strategies that can help you act before things escalate. Now, let's talk about what actually helps. Remineralization isn't magic, it's biology. Your saliva already contains the minerals needed to repair enamel. But modern habits, high sugar intake, acidic drinks, poor oral hygiene, constantly disrupt this balance. So the key isn't just brushing more, it's restoring the environment where your teeth can rebuild. Fluoride plays a role here. It helps strengthen enamel and makes it more resistant to acid attacks. That's why fluoride toothpaste is widely recommended by dental associations. But it doesn't stop there. Calcium and phosphate are essential too. Found in foods like dairy, leafy greens, and nuts, these minerals support the rebuilding process from within. Some products even combine these elements in bioavailable forms to enhance enamel repair. Then comes something most people underestimate: frequency. It's not just what you do, it's how often you expose your teeth to harmful conditions. Constant snacking, sipping sugary drinks throughout the day, These habits keep your mouth in a prolonged acidic state, preventing recovery. Creating pauses between meals, drinking water, allowing saliva to do its job, these small shifts make a measurable difference. And yet, even with all this information available, so many people still feel stuck. Not because they lack options, but because they feel overwhelmed, unsure where to start, afraid of making things worse, or simply anxious about the idea of dealing with it at all. If that sounds familiar, you're not alone. There's actually a growing recognition of dental anxiety as a real barrier, not just an excuse. And for those who feel that hesitation, there's an approach designed specifically to help navigate this phase safely and confidently. There's a method in the pinned comment for those who feel anxious about going to the dentist and want a safe alternative to take care of their teeth before it's too late. Because ignoring the problem doesn't make it disappear. It just makes the solution more complex later. What starts as a reversible condition can evolve into something that requires drilling, fillings, sometimes even more invasive procedures, not overnight, but gradually, quietly. And that's what makes this so important. You don't need to wait for pain to take action. You don't need to jump straight into expensive treatments, but you do need awareness. Understanding the difference between early stage demineralization and advanced decay changes everything. It shifts you from reactive to proactive, from fear to clarity, and from avoidance to control. Because the goal here isn't to avoid the dentist forever. It's to reduce the chances of needing invasive treatments by acting early, intelligently, and consistently. To work with your body, not against it. To recognize that small, daily action done at the right time can completely change the outcome. The hidden cost of waiting. Here's something most people don't calculate when they're deciding whether to address early tooth decay. The financial compounding effect of delay. A simple remineralization routine at home might cost you $20 or $30 a month. Maybe less. That's toothpaste with the right ingredients, a quality mouth rinse, perhaps a supplement to support mineral intake. Manageable, predictable, but wait 6 months, a year, and that white spot you ignored, it's now a cavity. Suddenly you're looking at a filling. Depending on where you live in the United States, that's anywhere from $150 to $300, without insurance, sometimes more. Wait longer still, and that cavity deepens. Now it's a root canal. You're talking $1,000, maybe $1,500 plus a crown on top of that, another $1,000, and if it goes beyond that point, extraction, implant. We're now in the range of $3,000 to $5,000 for one tooth. That's not fear-mongering. That's the trajectory. The same trajectory that starts with a sensation so minor, you almost talked yourself out of noticing it. But here's what really stings about this progression. At every stage, there was a window where simpler action could have stopped it. A moment where your body was still fighting back, still capable of repair. If only the environment had been right. The question isn't whether your teeth are worth the investment. The question is, why wait until the investment is 10 times higher? Because that's exactly what happens when early-stage decay is treated as not urgent. The problem doesn't stay small, it doesn't pause, it compounds, and with every passing month, the biological opportunity to reverse it shrinks. This is why so many people end up in the dentist's chair, blindsided by the severity of something that didn't even hurt that bad. Pain is a late-stage signal. By the time it arrives, the damage has already moved past the surface. Your enamel doesn't have nerve endings. You can lose significant structure before you feel anything at all. That's the trap. And it's one reason why understanding the science of what's happening beneath the surface changes everything. What your dentist might not have time to explain. Let's talk about pH for a moment. Your mouth is constantly shifting between acidic and neutral states. Every time you eat or drink something, especially anything with sugar or acid, the pH drops. When it falls below 5.5, your enamel begins to demineralize. That's the threshold. Below that point, minerals leach out. Above it, your saliva works to deposit them back in. Now here's the critical part. This process happens multiple times a day. It's normal, it's expected. Your body is designed to handle it, as long as the acidic periods are brief and followed by recovery time. But what happens when someone sips soda throughout the day, or snacks every hour, or constantly chews gum with sugar? The mouth never returns to neutral. The pH stays low. Demineralization continues without interruption. And the natural repair cycle, remineralization, never gets a chance to complete. That's when early decay becomes inevitable. Not because of one bad choice, but because of sustained exposure. This is why timing matters as much as the action itself. You could be brushing twice a day, using fluoride toothpaste, doing everything right, and still develop decay if your eating patterns keep your mouth in a constant acidic state. It's not about perfection, it's about rhythm. Allowing your saliva time to neutralize, giving your enamel space to rebuild, creating windows of recovery between exposures. And for most people, no one ever explained this. They were told to brush and floss. Important, yes, but incomplete. Because if you don't understand the pH cycle, you might be brushing diligently, while unknowingly sabotaging your own enamel between meals. That's the gap. And that's exactly where at-home strategies become powerful. The remineralization protocol. Most people miss. So let's get practical. If you're in that early stage, demineralization without cavitation, what actually works? First, fluoride exposure needs to be strategic, not just routine. Most people brush, rinse, and spit. Then they rinse with water immediately after. That washes away the fluoride before it has time to integrate into the enamel. Here's what changes the outcome. After brushing with fluoride toothpaste, spit. But don't rinse. Let the residual fluoride sit on your teeth, even for 30 minutes. That extended contact time allows the ions to penetrate and strengthen the enamel surface. It feels strange at first. Most of us were taught to rinse thoroughly. But the research is clear. Prolonged fluoride contact enhances remineralization significantly. Second, calcium and phosphate need to be bioavailable at the tooth surface, not just in your diet. Eating calcium-rich foods is helpful for overall health, but the minerals need to reach your enamel in ionic form to support repair. That's why products containing calcium phosphate compounds, like casein phosphopeptide amorphous calcium phosphate, or CPP-ACP, are gaining traction. These compounds bind to enamel and release ions slowly, creating a localized reservoir of minerals right where they're needed. Some remineralizing toothpastes and gums now include these ingredients specifically for this purpose. Third, pH management throughout the day. This is where xylitol becomes relevant. It's a sugar alcohol that doesn't feed the bacteria responsible for acid production. In fact, it disrupts their metabolism. Chewing xylitol gum after meals helps neutralize pH faster and stimulates saliva production, which is your body's primary remineralization tool. But here's the key. It needs to be used consistently. A piece of xylitol gum after every meal or snack, not occasionally, not when you remember, consistently. Because remineralization isn't a one-time event, it's a daily process. Fourth, reduce acid exposure where possible. This doesn't mean eliminating all acidic foods, it means being smarter about when and how you consume them. Drinking acidic beverages through a straw reduces contact with teeth. Consuming them with meals instead of between meals shortens the acidic window. Rinsing with water immediately after helps restore neutral pH faster. Small adjustments, big impact. And fifth, nighttime protection. Your saliva production drops significantly while you sleep. That's why overnight is the most vulnerable period for your teeth. Applying a remineralizing gel or using a fluoride mouth rinse right before bed creates a protective layer that works while your natural defenses are reduced. Some people even use prescription-strength fluoride gels for this purpose, especially if they're at higher risk for decay. Now, none of this is complicated, but it does require intention, and that's where most people stumble, not because the steps are hard, but because they underestimate how much these small, repeated actions actually matter. They expect immediate results, visible change, dramatic improvement. But remineralization is gradual. It's cellular, it's biochemical repair happening at a microscopic level. You won't see it in a week. But in 6 weeks, 8 weeks, the difference becomes measurable. The white spots fade, the sensitivity decreases, the rough texture smooths. That's your enamel rebuilding. That's your body responding to the environment you've created, and that's proof that you caught it in time. Why most at home? Advice fails, and how to avoid that. Let's address something uncomfortable. There's a lot of conflicting information out there about reversing tooth decay. Some of it is evidence-based, some of it is optimistic at best. You'll find articles claiming that oil pulling alone can reverse cavities, that activated charcoal whitening toothpaste strengthens enamel, that a specific diet will regrow teeth. Here's the truth. None of those claims hold up under scrutiny. Oil pulling has been studied. It may reduce bacteria in the mouth, which is helpful for gum health. But there's no credible evidence that it remineralizes enamel. It doesn't deliver the ions needed for repair. Activated charcoal is abrasive. It might whiten teeth temporarily by scrubbing away surface stains, but it also wears down enamel. That's the opposite of what you want when you're trying to rebuild. And while diet absolutely affects oral health, nutrient deficiencies can weaken teeth, no food will regrow enamel once it's lost. Enamel doesn't regenerate like bone or skin. It can remineralize if the structure is still intact, but it can't be regrown from nothing. This distinction matters because when people invest time, money, and hope into methods that don't work, they lose the window where effective action could have made a difference. That's the real danger of misinformation. Not that it's harmless, but that it delays the interventions that actually help. So how do you filter through the noise? Look for ingredients and methods backed by dental research. Fluoride, calcium phosphate compounds, xylitol, pH management. These aren't trends. They're supported by decades of clinical evidence. If something sounds too good to be true, reverse cavities overnight or regrow enamel naturally with this one trick, it probably is. Real remineralization is simple, but it's not instant. It requires consistency, the right materials, and realistic expectations. And if you're doing it at home, it also requires monitoring. That means checking in with a dentist periodically to ensure what you're doing is working. Not because you're incapable of managing it yourself, but because some changes are only visible with professional tools. An early cavity might look like a white spot to you. But under magnification or with diagnostic imaging, a dentist can tell whether it's stable, improving, or progressing. That feedback matters. It tells you whether your at-home protocol is sufficient or whether you need to adjust. Think of it like this. You're the primary caretaker of your oral health. The dentist is your consultant. You're not handing over control. You're getting confirmation that your efforts are on track. That's empowerment, not dependence. The psychological barrier no one talks about. Here's something that doesn't get discussed enough in dental health conversations: the emotional weight of dental problems. For many people, Tooth issues carry a level of shame that other health concerns don't. Cavities feel like evidence of failure, like proof that you didn't take care of yourself, that you were careless or lazy or irresponsible. And that shame becomes a barrier to action. People avoid the dentist not just because of cost or fear of pain, but because they don't want to be judged. They don't want to sit in that chair and hear, "You should have come in sooner, you should have been brushing better, you should have known." Even if the dentist never says that, the internal voice already has. This is why so many people wait until the pain is unbearable, because at that point there's no choice. The shame is overridden by necessity, but by then the damage is done. And the irony is, most dental professionals aren't judging. They've seen it all. They understand that life gets in the way, that dental anxiety is real, that access and affordability are barriers, but that understanding doesn't erase the patient's internalized shame. So they stay away. And the cycle continues. This is where at-home care becomes more than just practical. It becomes psychological relief, because taking action, even small action, shifts the internal narrative. You're no longer the person ignoring the problem. You're the person doing something about it. You're no longer passive. You're engaged. And that shift, that sense of agency, can break the paralysis that shame creates. It doesn't require a dentist appointment to start. It doesn't require a financial commitment you're not ready for. It doesn't require confronting the fear all at once. It just requires the first step: buying the right toothpaste, using it correctly, adding a rinse, adjusting your habits, small actions that say, "I'm taking care of this. I'm not ignoring it anymore." And psychologically, that changes everything, because once you start, momentum builds. The sensitivity decreases and you notice. The rough spot smooths and you feel it. The anxiety lessens and you realize, maybe this isn't as insurmountable as you thought. Maybe you can handle this. Maybe you're not too late. And that realization that you still have control is what finally breaks the cycle of avoidance. What happens if you miss the window? Let's be clear about what we're talking about when we say reversible decay. Demineralization, the white spot stage, can be reversed. The enamel can be remineralized. The process can be stopped and even repaired. But once the decay progresses to cavitation, there's an actual hole in the tooth. Reversal is no longer possible. At that point, the structure is gone. No amount of fluoride, calcium, or dietary change will rebuild a cavity. The only option is mechanical intervention: drilling, filling, restoration. This isn't meant to scare you, it's meant to clarify the timeline. There is a real biological deadline. And while it's not measured in days or weeks, it's also not infinite. The progression from white spot to cavity varies depending on several factors: your oral hygiene, your diet, your saliva quality, your genetics, the specific bacteria in your mouth. For some people, it might take months. For others, it could happen faster. That's why early action is so critical, because you don't always know which category you fall into. You don't know if your demineralization will stay stable for a year or progress to cavitation in 3 months. What you do know is this: acting now gives you the best chance. Waiting removes options. And once a cavity forms, the cost, financially, physically, emotionally, increases dramatically. The filling itself isn't the end of the story either. Fillings don't last forever. They break down, they leak. They need replacement. And each time a filling is replaced, more tooth structure is removed. Over time, that tooth becomes weaker, more prone to fracture, more likely to need a crown or a root canal or extraction. That's the cascade, and it starts with a reversible white spot that no one addressed. This is why prevention isn't just about avoiding pain, it's about preserving the structural integrity of your teeth for the long term. Because every intervention, even a small one, reduces the tooth's overall lifespan, and every intervention avoided by catching decay early extends it. That's the real value of remineralization, not just stopping a cavity today, but protecting the tooth for decades. The role of saliva and why it's more important than you think. Let's talk about something most people completely overlook: saliva quality. Your saliva is your mouth's first line of defense. It neutralizes acid. It delivers calcium and phosphate. It contains enzymes that break down bacteria. It's literally a remineralizing solution running through your mouth all day. But not everyone's saliva works the same way. Some people produce less saliva due to medication side effects, antihistamines, antidepressants, blood pressure medications. These are common culprits. Some people have naturally lower saliva flow due to conditions like Sjögren's syndrome. And some people unknowingly reduce their saliva production through habits like mouth breathing, smoking, or chronic dehydration. When saliva flow decreases, everything changes. The mouth stays more acidic, bacteria thrive, demineralization accelerates, and the natural repair process, remineralization, slows to a crawl. This is why two people with similar diets and hygiene habits can have vastly different decay rates. It's not just about what they're doing, it's about what their saliva is capable of. So if you're someone who deals with dry mouth, even occasionally, this needs to be addressed as part of your remineralization strategy. Drinking more water is a start, but it's not enough if the underlying issue is medication-related or physiological. In those cases, saliva substitutes or stimulants become necessary. Products designed to mimic saliva's protective properties, lozenges or sprays that stimulate gland production. There are also prescription options for people with chronic dry mouth. But here's the key. You need to recognize that dry mouth isn't just uncomfortable, it's a risk factor. One that makes early decay much more likely to progress, even if you're doing everything else right. That's why paying attention to how your mouth feels throughout the day matters. If your mouth feels sticky, or your tongue feels rough against your teeth, or you're constantly reaching for water, those are signs that your saliva isn't doing its job. And that means your remineralization potential is compromised. Addressing it isn't optional if you want to reverse early decay. It's essential. The truth about natural remineralization. Methods. There's a growing interest in natural and holistic approaches to dental care. And some of them do have merit, but let's separate what's supported by evidence from what's based on hope. Bone broth, for example, is rich in minerals. Consuming it regularly can support overall bone health, including jawbone density. But it doesn't directly remineralize tooth enamel. The minerals have to reach the tooth surface in ionic form, which doesn't happen just from drinking broth. Raw dairy products, particularly cheese, have been shown to have protective effects on teeth. The calcium and phosphate content is high, and the act of chewing stimulates saliva. That's helpful. But again, it's supportive, not sufficient on its own. Vitamin D and K2 are crucial for calcium metabolism. Without adequate levels, your body can't properly utilize dietary calcium. So supplementation or dietary focus here can indirectly support oral health, but they don't reverse existing demineralization without topical intervention. The pattern here is clear. Internal nutrition supports the foundation, but remineralization at the enamel surface requires direct contact with the right compounds. That's why fluoride toothpaste works, that's why CPP-ACP works, that's why topical gels work. They deliver the ions exactly where they're needed, so if you prefer a more natural approach, that's completely valid, but combine it with strategies that have direct enamel contact. Use a remineralizing toothpaste, use a pH neutralizing rinse, manage your acid exposure. Don't rely solely on diet and hope the minerals will find their way to your enamel. They won't. At least not effectively enough to reverse demineralization before it progresses. when at-home care isn't enough. Let's be honest about the limitations. At-home remineralization work for early-stage demineralization. White spots, mild sensitivity, surface roughness. If you're in that stage, consistent application of the right strategies can absolutely reverse the process. But if you're experiencing pain, if the discoloration is brown or dark, if there's visible damage or structural change, you're likely past the window where at-home care alone will suffice. That doesn't mean you failed. It means the decay progressed beyond the reversible stage. And at that point, professional intervention is necessary, not as punishment, not as failure, but as the appropriate next step. Because trying to manage advanced decay at home out of fear or cost concerns or denial will only make the situation worse. A small cavity left untreated becomes a large cavity. A large cavity becomes an infection. An infection becomes an abscess. An abscess becomes a medical emergency. That's not exaggeration, that's the clinical trajectory. So if you're reading this and you know deep down that what you're dealing with is beyond the early stage, the most responsible thing you can do is seek professional evaluation. Not eventually, not when it gets unbearable. Now. Because the cost and complexity only increase with time. And the longer you wait, the fewer options you'll have. But if you're in the early stage, if you caught it when it was still just a signal, a whisper, a warning, then you have the opportunity that so many people miss, the opportunity to stop it, to reverse it, to take control before it controls you. And that's exactly what this entire conversation has been about. The final truth about taking action. Here's what it all comes down to. You can have all the information in the world. You can understand demineralization, remineralization, pH cycles, fluoride mechanisms, saliva quality, bioavailable minerals. But if you don't act, none of it matters. Knowledge without application is just noise. And when it comes to tooth decay, inaction has a cost. Not immediately, not dramatically, but steadily, quietly, inevitably. What feels like waiting to see if it gets better is actually allowing it to get worse, because demineralization doesn't pause, it doesn't plateau, it continues until something changes the environment. And that something is you, your choices, your habits, your willingness to do small things consistently. That's the shift from hoping it resolves on its own to creating the conditions where resolution becomes possible, from treating your teeth like they're supposed to take care of themselves, to recognizing that they need your support, and from fearing what might happen, to knowing you did everything you could to prevent it. Because that's what this is really about, not perfection, not guarantees, not eliminating all risk, but doing what's within your control, while you still have the window to do it. So if you've been putting this off, waiting for a sign, waiting for permission, waiting for the right time, this is it. This is the moment, not when it hurts, not when it's obvious, not when you have no other choice. Now, while it's still reversible, while your body is still capable of repair, while the solution is still simple, because the quiet signal you've been feeling isn't going to get louder just to convince you. It's going to get worse. And by the time it's loud enough to force action, the opportunity for reversal will be gone, so pay attention, act early, and most importantly, don't let uncertainty make the decision for you. If this opened your eyes in any way, make sure to subscribe to the channel, because this is just the beginning. There's a lot more coming that can help you understand your body better, make smarter decisions, and stay ahead before problems grow into something bigger. Your teeth are worth it. You're worth it. And the time to act is now.